So one of the questions that I also wanted to ask you about is being a techie and new to healthcare in terms of full-time role. Share with us one or two of the product projects that Providence is involved in from an AI standpoint, artificial intelligence, where you're collecting data that's just blowing you, that even as savvy as you are as with technology, that you're like, wow, the fact that we have our hands on this and we can do this with it is amazing. So I'd love to get a couple examples of that folks might not know about.
Yeah, one example is, we signed a strategic partnership with Microsoft. It would have been July 2019. And, one things we wanted access to was Microsoft's engineers run artificial intelligence and pair them up with our world-class clinicians and researchers. And one pilot we did with them is around cancer natural language processing. So we took patients who opted into, doing this investigative work. And the insights that we had is we think in the clinical note itself, there's a lot of information about a cancer diagnosis before a cancer diagnosis. And so the theory was, could we use artificial intelligence to actually read those clinical notes before somebody had cancer, after they had cancer, and could we get early insights? And what came out of that is, there's early insights in the notes that are locked in the notes that a doctor's put in there that a human being couldn't go through and read just thousands and thousands and thousands of pages of notes and have these insights. So you put this artificial intelligence, natural language processing over the notes, and they found these correlations. And then we were able to apply that to patients in the future, read a patient's notes and saying, okay, based upon the things that are in these notes, we believe these patients may be at risk for cancer. And so then we're able to more proactively engage with those patients, maybe identify their cancer earlier and process, because obviously the earlier you detect cancer, the more success you're going to have in treating that. So that's a great example of taking something where, a human being can read a clinical note, but that could take an hour, whereas an artificial intelligence bot in an hour could read tens of thousands of clinical notes and then gain insights from that. So that's probably the most tangible example I could give of the partnership and what technology can do for us that human beings just can't scale to do.
Well, and that is exciting. One of the other things I wanted to ask you about is more of a local innovation that has been implemented by Providence. In the conversations I've had with other executives, they've given great examples of how one of the things Providence does very well is make sure they're looking at each community and the community needs on an individual basis, whether it's Washington, California, in the Southwest somewhere. Could you share with us a discussion or an example of an innovation where you're called in to say, hey, there's a couple of niche issues in this community we'd like to address. Could you help us with this?
I don't know that I can give you a specific example. I can talk to, you're talking about the concept of population health and how do we manage the health of a community or a broader population versus an individual. So that's certainly something we're looking at using, big data. How do we have, data sets that we have of our own communities from our own health systems, but also, it could be economic data from the federal or state governments. It could be additional data points that we put in these databases to gain insights. And to your point, then it gives you insights into a local community to say, okay, this local community may have a unique need. How do we intervene or have a program? It could be a vaccination program, could be some sort of educational program to go in and help those community out. So the concept is there. We're building the building blocks. I can't give you a specific example. That's not an area that I personally own, but conceptually, how you can use big data and then the data tools to have insights to those communities is absolutely something we're looking at.